The vaccination drive continues in Gauteng. Doctors at Steve Biko Hospital in Pretoria are complaining of long queues and no social distancing. Our reporter Manqoba Mchunu is there and joins us now. Manqoba, we've heard some reports of vaccinations going well in the Western Cape. However, that's not the case here in Gauteng. Give us an update on what was supposed to happen today. We understand that the Baragwanath Hospital's vaccine site did not open as intended. Did the long queues at the Steve Biko Hospital have anything to do with that situation?
Well, certainly, Andy, we do understand that the Chris Baragwanath Hospital was not open today. In fact, me and my colleague Mashudu Ramachela drove there earlier on, and we saw that, in fact, there were no vaccinations that were taking place there this morning. And I guess this is what has kind of compounded the situation here at the Steve Biko Hospital, where many of those doctors have had to wait in quite long queues. And we do understand that the waiting time has been something between 3 hours as well as 5 hours, and many of them quite frustrated given the fact that they were here hoping to receive their jabs. We do also understand that the line has also been cut short, and some of those healthcare workers have been told to reschedule their appointments. But I just want to get to speak to some of them that were there just to get a sense of what happened this morning. Let me ask Dr. Annelies Geldenhuys to speak to us now. Doctor, obviously you're one of the doctors that came here this morning. How has it been?
Well, it has been a bit of a challenge, right? I arrived just after 9 o'clock, and it's been about 6 hours since I entered the hospital until I've exited after I've received my vaccine. So it has been a little bit of a frustration and definitely a hurry up and wait situation.
And in terms of what do you think should improve here? I mean, surely this could have been avoided.
Well, I have to say that as the day progressed, we could see that people intervening, and that even just as it got later during the day, systems improved. So I do think that everyone and the department is just going through a bit of growth pains, and there's always hope, but we definitely need to streamline this if we want this vaccine rollout to be a success.
And in terms of you yourself, I know that you've also been vaccinated. You are a frontline worker. Are you excited?
Well, it's actually a bit ironic, but yes, I haven't been excited about something like this for a very long time. So yeah, we are hopeful. We are excited to see the implementation of this vaccine rollout and also the impact that it's going to help or have on our healthcare system.
Okay, thank you. Let me move on to Dr. Petru du Plessis. Doctor, your experience here this morning, how has it been?
I agree with Dr. Geldenhuys, it was challenging, but the staff really did their absolute best. They tried to accommodate us, they kept us up to speed, where we are, where we're supposed to go, which we really appreciated. The sisters that vaccinated us were extremely helpful. They were knowledgeable, they could give us all the instructions that we needed, all the things that we need to look out for. So in terms of that, definitely good, but yeah, we need to streamline the situation because we were here now for 6 hours, so it was quite a long day.
Okay. And are you relieved that finally you also have received your jab?
Very relieved and very excited. I had COVID last year in June, so I was really first in line to get this vaccine because obviously this is going to change the situation for us. So we are very excited and we feel very privileged that we were allowed this opportunity.
Okay, thank you very much for speaking to us. And yeah, you can hear some of the sentiments from the doctors, but I just want to quickly bring in the CEO of the hospital, Dr. Matapo, to join me here. Please come and join me, Doctor, so that we can speak to you about some of these issues that have been raised here. Dr. Matapo, thank you for your time. First of all, many of the doctors complaining that the queues were long. What happened?
The queues were long because we are the only site that is operating today, and people came from everywhere. We didn't anticipate to see this volume. As we speak now, we are projecting that we are having people more than 900, and we had planned for 250 at the most. But the uptake we appreciate, and we are glad that people are taking a vaccine and are protected, and we are in the forefront to assist our colleagues to survive the virus. And we have availed the facility, we have availed the staff to assist them, and we can reassure them that the 1,000 that is anticipated to be covered today will be covered today.
Okay. Thank you, Doctor. I'm letting you go because I see Mutaletale Modiba, who speaks on behalf of the Gauteng Health Department, has just arrived. Mutaletale, if you can just join me here so that we can iron out some of these issues that have been raised by these healthcare workers today. Of course, many of them saying that they have waited here for several hours to receive their jabs. Of course, we've just heard from the CEO. They didn't expect the numbers that they got here today, and this is because the Chris Baragwanath Hospital has also been closed. Let me speak to Mutaletale now. Mutaletale, let's start here. This situation surely could have been avoided. What happened?
Look, I think there are two ways of looking at the situation. One way of looking at it is that it shows that the demand is now growing. More and more health workers actually want to come up front and participate in the program. If you remember where we started, when the minister announced that the vaccine, the doses are arriving on Wednesday, there was a bit of hesitancy and doubt among some of the health workers. And now the fact that you are having a situation where now you're having to manage, I think it's a question of the flow of information in terms of people understanding how the process works. That you register on the system, and when you register on the system, you do indicate the facility that you are from, so that the system, when it issues a voucher, it's able to link you to the particular facility that you need to come to. And you've got two facilities. You've got the Steve Biko, you've got the Chris Hani, which are part of phase 1. Because in phase 1, we have received a limited number of doses that have been allocated to those facilities. It does not mean that other facilities are not going to be accommodated. We are going to accommodate other facilities, and hence we keep on reminding our healthcare workers of the importance of, one, registering on the system, indicating the particular facility that you are linked to, but secondly, only going to a particular facility when you have received a message that indicates that you've got an appointment.
But the Baragwanath Hospital was closed today. In fact, we drove there, it was closed there. And this is what has made matters worse here. Why was it closed?
The Baragwana, we've got two facilities. Baragwana there was never a plan for Baragwana to operate this particular weekend. And therefore, people that are scheduled for Baragwana would not have received a message telling them to come to Bara for this particular weekend. And in any case, if you are scheduled to go to Bara, you would not receive a message that says you must come to Steve Biko. So everyone receives a specific message that tells you to go to the facility that you are linked to. So that's why we're urging everyone to say, when you have already specified which facility you are going to, don't panic. There are enough doses to accommodate everyone. And in the coming weeks, as the minister has already indicated that the vaccines will be arriving in batches, we will then obviously activate other facilities within the province to make sure that ultimately all our healthcare workers are vaccinated. No one is going to be left behind.
Okay. But in terms of, we do know that many of those healthcare workers, the general practitioners in particular, were meant to be vaccinated today, but some of them had to return back home without getting their vaccines.
As far as I know, the facility, those that were scheduled to come here to Steve Biko were accommodated. As we are speaking now, the process is still underway inside the facility. I think that today the facility had planned, or MRC had planned to vaccinate about 1,000 people or so. And around after lunchtime, you had over 721 people that were on the queues. So ultimately, everyone is going to get vaccinated. I think that's the message we need to get across. The only thing that we need to do the reason why there's a voucher system is to ensure that we control the traffic flow. Because while this program is going on, there are also other healthcare programs that needs to continue within the facility. But also, we are still living within a COVID environment, which means that we need to ensure that we adhere to the protocol. So you can't have a situation where you have masses and masses of people now in a very congested environment coming in to vaccinate. You need to stagger it in so that while you are vaccinating, you still protect the very same healthcare workers who need to be vaccinated.
But the genuine concern from these healthcare workers, Mutaletal, is that there's only a limited number of vaccines that are here. The doses here in this hospital is only 5,700, and they are quite genuinely concerned that they will run out. So that's why they're saying that they've come here. Is there any fact to this?
I think the MEC earlier today issued a statement actually allaying fears among healthcare workers that they should not panic, they should not worry. None of them is going to be left behind. There's no one who's not going to be vaccinated at the end of the program. You would recall that this is an implementation study in terms of this phase 1 that we're in. And as part of this phase, there is a number of vaccines that are coming into the country. I think between 300,000 to 500,000 that will be here. Those will be sufficient. Obviously, there's also, government is busy procuring other vaccines. Ultimately, as part of phase 1, all healthcare workers in the province of Gauteng and in the country will be vaccinated. So there's absolutely no reason for anyone to panic.
Thank you. That was Mutale Tala speaking to us here about this vaccination program. Of course, many of those doctors are still inside, we do understand, and they are still waiting to be vaccinated.
Thank you very much, Manqoba Mchunu, coming to us from Steve Biko Academic Hospital. The message there very clearly that all healthcare practitioners must register via the electronic vaccination data system in order to get a voucher that also specifies when and where they will go for their vaccination.